The EMPA-REG outcome study with empagliflozin was the first study that showed superiority for cardiovascular outcomes with an oral anti-diabetic drug with an SGLT2 inhibitor. And that was unexpected and very positive, of course, because it makes treatment for type 2 diabetes in high-risk patients with cardiovascular disease a lot easier and gives a better outcome. Well, it may very well be that the SGLT2 inhibitors as a class have very similar cardiovascular beneficial effects. Recently, just a couple of weeks ago, a large retrospective analysis was published by Kosiborod and colleagues looking at registries in various countries in a real-world setting, showing that people on SGLT2 inhibitor treatment and cardiovascular risk had a reduction of total mortality and cardiovascular endpoints, which is very important. It is a very interesting question whether the study results of the EMPA-REG outcome study can be applied to a broader group or cohort of patients with a different cardiovascular risk profile or no risk profile in cardiovascular events. This has to be examined in clinical studies, and there are clinical studies ongoing at the moment with empagliflozin and other SGLT2 inhibitors to test that hypothesis. The key findings are that in every country the study looked at, total mortality was significantly reduced in the patients who were on SGLT2 inhibitor treatment versus other treatments for type 2 diabetes. And I think this is a very important result showing the beneficial effect these agents have in a real-world setting under normal treatment conditions with GPs prescribing those drugs and with patients being not enrolled in a prospective trial. We have learned from dapagliflozin from the study we just discussed and also from other retrospective analyses that this SGLT2 inhibitor probably also has cardiovascular benefits. We will certainly know by 2019 when the prospective randomized trial DECLARE that looks at this question will be finished and the results will be published. Well, I'm very much interested in the results of the CANVAS study tomorrow because it will be the second prospective study on cardiovascular outcomes with an SGLT2 inhibitor. So far we have not had a publication beforehand for the investors or the press with a top-line result, so I don't know what the outcome is. And it'll be very interesting to look at the results, but not only the primary endpoint, but also other analyses on secondary endpoints and special populations who may profit from this treatment.